myself Faysal Aziz Khan, welcoming you, being the part of an informal discussion on one of the extremely crucial issue, I would say not only for Pakistan but entire region. That is evolution of education and health care in Pakistan. We have only 40 minutes for this session, unfortunately. But I would introduce here the highly regarded speakers of the panel, starting with Dr. Huma Baqai Saiba. She is Senior Vice-Chairperson, KCFR, and Associate Professor, Institute of Business Administration, IBA, Karachi. Dr. Marc, Siegel, President, Siegel Associates. Dr. Zangwill, Professor, University of California, and Mr. Shah, CEO, iPath Private Limited, Pakistan. The short background of Pakistan education and health. Pakistan's education system has evolved from the both Islamic and British historic roots. It has improved greatly in 20th and 21st century, but it still tends to rely too heavily to rote mobilization and outdated teaching and examination methods. However, in recent years, Pakistan has adopted increasingly modern methods of teaching and examinations. On the other hand, Islamic traditions remain very much alive in society, whereas civic has recently been introduced in school curriculum in place of Islamiyat for religious minority population. Secondly, according to Global Youth Development Index published by Commonwealth, a measure which uses the domain of civic participation, education, employment and opportunity, health and well-being, and political participation to gauge the progress of young people, Pakistan ranked only 154th of 183 countries, trailing sub-Sahara African nations like Sierra Leone and Ethiopia. Perhaps most strictly, but Pakistan has the highest number of out-of-school children worldwide after Nigeria. Approximately 22.7 million Pakistani children aged 5 to 16 and 44% of age group did not participate in education in 2017 as per Ministry of Education, Government of Pakistan. The situation in this, I'm cutting short because we have short time. According to Human Rights Watch, 32% of girls of elementary school age are out of school compared with 21% of boys. By grade 6, only 41% of girls participating in education compared with 51% of boys. And by the grade 9, nearly 13% of young women are still enrolled in schools. Crucially, Pakistan devotes comparatively few resources to education and trail regional countries like India or Nepal or Bangladesh. Education spending. In 2017, Pakistan spent only 2.9% of its GDP on education, far below the government official targets of 4%. On the other hand, studies have shown that Pakistan's private sector healthcare system is outperforming the public sector healthcare system in terms of service, quality, patient satisfaction, with 70% of population being served by the private health sector. Studies have shown that Pakistan private sector However, as per the claim of the ruling political party of province of Sindh, Pakistan People's Party, 500 health institutes have been established in Sindh in last 14 years of their government. Not really sure about the accuracy of this claim, but can see some visible improvement in the health sector at least. Yet the federal government to claim that the development throughout during this period, there are multiple other aspects and challenges associated with the educational health system in Pakistan, like unemployment and other many more that I would like to on it the panelists to put light on. I would request Dr. Huma Baqai Saiba to give that opinion.
Thank you so much. I'm kind of glad that he's done a curtain raiser on what are the statistics on education in Pakistan are. Because I'm sitting at Pakistan Pavilion and I hate to paint a grim picture. I would like to say things are nice. I would like to say that we're doing well. But thank you, Faysal, for giving those statistics. What probably I will dive into it is why has this happened to Pakistan? And I think, and I've been associated with education for the last 25 years. What has happened to education is that I think greed-driven capitalism in Pakistan has destroyed education, where gradually we turned education into a privilege and not a right, and more so how we allowed the private sector to take over the responsibility of imparting good education, and the public sector was left to deteriorate to a point where now it's almost turned into a joke. I've been associated with a public sector university for last 12 years, and then I moved on to a public sector university which was run like a private university. And that is why one is where degrees are turned out, which are not even worth the paper they're written on, and other is called an island of excellence in Pakistan. But can we get on with this? Because what the percentage of what the private education is, it's like a drop in the ocean. And what the rest of the country is left to is institutions that are imparting absolutely compromised education. Is it a function of money? It could be, because we allocate very little money to education. But what is perhaps even more interesting is that we don't even spend what is allocated on it to education. And what is spent in a way where it is not benefiting the masses, the people. So when I talk about problems of Pakistan, the thing that comes to my mind immediately is that how elite capture of policy making has turned it into a state which will only cater to the elite. And as a result, the middle class and the lower middle class, when looking for upward social mobility, for which education is the only tool, will actually go to any lengths to educate their children in schools and colleges which are very expensive, even in Pakistan. So I know families who sell out their property to put their children in schools. So that is one aspect that I wanted to speak about. I think it's greed-driven capitalism that has done this to the education. And when you leave a subject like education to the markets work for profits. Pakistan is a country where education is a need, and we need to have a need-driven strategy to handle it. The second thing that I want to sort of really come up on is that while we were doing this, we also commodified education. So we commodified education, it became a commodity that could sell. So you had mushrooming of institutions that were giving degrees in business, and IT and entrepreneurship, which is the new buzzword, and we stopped teaching our people history and literature and social sciences, and then we said, why is there so much extremism in our society? There's so much extremism in our society because we stopped lubricating our education with subjects which allowed people, which allowed education, which humanized education, if I may say so. And I know we are short of time. So that too, commodification of education, and then how we have been unable to relate imparting of education and coming up of universities and the deterioration of the public sector to the demographic explosion that Pakistan is experiencing. We were the 6th largest country. Linda, just before this discussion looked up, we've become the 5th largest country in the world. These are people that are counted. We have huge numbers that are not a part of the census, they're not even counted. Nevertheless, there are children who are out of school, and they will grow up like that. So the problem is horrifying, because we have people who are not going to schools, and then we have people who are going to schools and are not being imparted good education. And if then you compare it to what is happening globally, the picture is even more grim, because on the global front, we're sitting here at Davos, and here people are talking about Education 4, which is supposed to match with the Industrial Revolution 4, and we're talking about teaching students critical thinking, problem-solving skills. And they say that if you give that skill to the children, it will actually add. It makes a lot of good economic sense. It will add something like $2.5 trillion to the global economy if education is done that way. Now, people are thinking about how education is done. We are still struggling with trying to educate everyone. Our literacy levels are low, and our literacy levels are counted when a person can sign his or her name. That's not literacy. What is the way forward? I think the way forward is a multi-pronged strategy where we realize that if we want a tomorrow, if Pakistan wants a tomorrow, there is no way we can continue with the neglect that is happening right now. And we need to have an approach where we can educate our masses and not have affirmative action or interventions that are for people, for a few. For example, you have TCF and you have private initiatives, you have philanthropy, where education is supported, but largely nothing is being done for the masses. And I think that needs to change. I'll be very happy to answer questions, but right now, the way education is in Pakistan, it's, like I said, it's horrifying. And what is worse is that post-pandemic, the girl child has suffered more, because the girl child who got out of schools never went back. So they've not gone back to schools. So I think, and I say this often, that if there is one emergency that Pakistan needs, it's an educational emergency. I'm not going to comment on healthcare because I am not competent enough to do that, but ladies and gentlemen, it is as bad. And you need to connect the dots to the demographic explosion, because you can make good universities, more hospitals, but somehow the population growth is horrifying. Pakistan still is about 3.5 children per women, which is one of the highest in the world. Thank you so much for your time and attention.
Thank you, Dr. Huma. Thank you so much. The situation is basically embarrassing, horrifying. Dr. Lida Zangwill, your say on Pakistan's education system.
I feel like really not qualified to talk about the education system. I was going to say a few words about healthcare.
Yeah, sure.
I'm a professor in the School of Medicine at University of California, San Diego, and I'm in ophthalmology in a very subspecialty area. So my expertise is not on healthcare systems or on health care administration, but I'll just say a few things at a higher level, that with population explosions and connecting the situation to some technological possibilities for solutions. Another revolution that is discussed at length in Davos is artificial intelligence. And it is transforming healthcare systems. And it's not only in well-to-do urban settings with a lot of high tech. That's one thing that is happening. It's helping clinicians make decisions, who's going to get sepsis in the hospital, etc. But the other way, the other application is to the underserved areas. That if you can have a smartphone, maybe not even connected to the internet, but with some software on it, and are examining examining patients. For example, I look at eye disease, and the first FDA approved, which is the agency in the US that approves drugs, and now they approve software. The first application for an FDA approved AI device was for screening for diabetic retinopathy by a photograph. Right now, so diabetes is a problem everywhere, and diabetic retinopathy is a huge blinding disease. This is just one example. But to move this to primary care, to move it to the rural areas, serve the underserved areas more widely with an expertise that is much greater than the personnel, perhaps, that are available in these underserved communities. And we're doing this, trying to do this in the United States, which has a tremendous underserved communities in the healthcare system, even though we're a very wealthy nation. And I'm sure Pakistan is the problem is even larger. But to develop systems that can help the clinician and have perhaps non-physician healthcare workers doing the triage. This person does not need to see an eye doctor. This person really should see an eye doctor soon. And to really try to bring the healthcare system to be able to manage some of these patients, to manage some of these communities. I know we heard earlier this morning about a lack of cell phones, not the internet and things like that. So there's ways of doing this without all the technical requirements that one would think. So that's just one thing that's really happening with telehealth. It also exploded because of COVID, where lots of people were not getting to the doctors, and so that people were relying on not seeing their physician, not seeing their healthcare worker in person. And that's another way that we can perhaps build infrastructure, and it doesn't have to be all high-tech, some of it can be high-tech, to be able to provide healthcare to the many, many underserved people in Pakistan. There's a lot of concerns about it. There's a lot of problems that have to be resolved, but I think they are doable, and I think the benefits of this we're seeing. I know headlines in the US was Google was going to be screening for eye disease in rural communities, and the big high tech, they're going to make it affordable. They're going to make it accessible to communities that are underserved worldwide.
Thank you. Thank you, Mr. Lisa. I would like to invite Dr. Siegel. So how do you see the educational system of Pakistan?
I'm going to talk about it from a different perspective. I'm in a think tank of some of the largest supply chain companies in the world, mostly American and European. And I also teach in an MBA program that's focused on supply chain management. And one of the things that is a problem, if you think that the problem in Pakistan is that education has been commoditized, supply chain companies have humanitized humans. They really don't care what you have to sell or about the person who's selling it. They're looking for whatever is the cheapest they can get something for. But key to that is also that they want to work with people who can minimize their risk as much as possible, particularly any blowback risk to the company itself by an event that would take place that would hurt their reputation. So in that space, Pakistan, every time I've been there, I hear people brag about, we produce this many engineers, and we have this many programmers, and we have this many people in high tech. They're everywhere. These companies are looking for those skills in any country they can get it. And the big selling point for them is, can they operate in your country, and can you minimize their risk as much as possible in terms of quality of service, potential for business disruption, and damaging their reputation. So one of the areas that I think really needs to be developed to make Pakistan more competitive with all these other countries that are offering the same thing is to look at how to develop more after somebody graduates from university, or even when they're going through their first degree. If you're doing a degree in engineering and you're doing a degree in programming and in coding, that you also commingle that with business skills of how does, if you're trying to do a startup, give the person some entrepreneurial skills, give them the business communication skills, and also very important, give them the skills that they can actually go to these companies and pitch their technology and pitch their company from the perspective of, we can deliver you that quality, we can avoid disruptions that will hamper your operations. Because remember, they're getting maybe one little piece from here, another piece from another country. They can't afford downtime at all. And if I can't share with you some of the games they played during COVID, but they were cutthroat and really put people's health in danger in developing countries to make sure they still got their stuff in their supply chain. And to be able to pitch to them that, yes, we have the business skills. Yes, Pakistan is a high-risk environment, but we also know that if you can come and operate in this country, we've been trained in the key areas of governance, compliance, and risk management, that you will have the level of comfort to be able to do business in Pakistan. And then just quickly before ending, I want to shift gears, because after listening to Huma and Linda give their talk, I've been working in Moldova, working with the Ukrainian refugees since March. And two programs that we're setting up made me really think about how applicable these would be, because Moldova is an incredibly poor country. They've been flooded per capita with more refugees than any other place. And we've had to think of, how do you come up with incredibly cheap solutions to do outreach to all these people who have been dispersed into the countryside. So Moldova is 75% rural, and about 90% of the refugees are dispersed in this rural environment. And if you think your roads are bad, go visit Moldova and you'll be proud of your roads. And well, two programs we set up that seem to be a slight twist on what other people are doing. Instead of just doing remote learning, we're setting up classrooms where we're taking a teacher who is a refugee, and the kids sit in a classroom environment. Instead of spending all the money on laptops for everybody, it's one laptop per class, one projector, one screen, and one teacher who is in the classroom with the students. So they have the social environment, and then they're being able to tap into well-developed resources for remote learning and having a teacher there to help them. And it's incredibly cheap. We even came up with a bizarre scheme with Amazon to get free computers into classrooms. So that's one of the things we're doing. And then the other thing, again, because you have all these people dispersed out in the countryside and they have very little access to healthcare, the people who actually are the Moldovans living in the countryside have little access to healthcare. It's matching them with companies who do remote healthcare and have developed those tools already, matching them with people in the universities and in the medical system so they can do the local culture and the local language skills. And by marrying those two things together, this is what I'm setting up when we're going after here, is hopefully that pushes more resources out into the countryside and takes advantage of in some ways, these companies that have developed the software who are interested in the long run of giving it away for free at first, but then working as a way of developing a commercial venture out of it. So that might be two things that are possible to copy and to try to move things out to the countryside.
Very positive solutions. Thank you, Dr. Shah sir, we have only 10 minutes. You have to.
I won't take a lot of time. As a technologist, I look at things, how we can solve problems through the use of technology. And what we've all learned in the past 2 years is the biggest digital transformation revolution of the 21st century was not led by a technology or company or people, it was led by a virus.
Right.
And, and having that technology at that time, starting from healthcare systems, healthcare management systems, getting people into remote working places, making things accessible to them was extremely important. Now, what we've done is we looked at a problem particularly to solve in the North American market, and that was basically the interoperability of healthcare data. So this isn't a problem for Pakistan. When we talk about Pakistan, we always talk about, we've set up so and so many hospitals, and under some program so and so many clinics would be set up. But when you look at a very developed market, such as North America, so as to speak, under the impression, there are very interesting findings as far as healthcare data interoperability is concerned. So in the US, what we found was healthcare networks don't share data with each other. So 80% of all serious medical errors involved were during miscommunication during care transition. So we're talking about one patient being transferred from one facility to another, but the discharge summary or the continuity of care documents weren't properly filled out, or it was not available to the other healthcare system, which resulted in a malpractice. Then we found out that 3 out of 10 lab tests in the US are repeated lab tests just because people don't have access to their data. One doctor does not. If someone has type 2 diabetes, for example, or if a doctor has written a test for someone, and the same patient basically goes to another healthcare provider, the other healthcare provider has no access to that data. So what eventually happens is they reorder the lab test. Now this adds up as a significant cost to the government as well as for the insurance companies as well. Then we found out that only 3 out of 10 individuals in the US have access, either direct access or indirect access to their medical records. And even if they have access, one in four people have to reiterate their medical history to the healthcare provider again. So in the US, when you go to a doctor, you are filling out forms, you are taking your medication statement, and you are using your memory to tell them, so-and-so doctor told me this about my medical condition, and these are the medications I'm taking. So it is actually in the best effort of the patient to communicate all this information to the healthcare provider. Mm-hmm. And what does it lead to? Basically, 20% of malpractice cases involve miscommunication or a delay in getting the information available. So, when you're looking at the North American market, saying that this is basic. You have the Silicon Valley. This is where technology gets born and evolved. And yet, this is a country where there is a serious healthcare interchange crisis. So what we did, we basically built a platform. It's called MyMediport, and we tried to solve the problem from multiple angles. So at first, we basically gave patients access to their medical data. So we said, under the ONC regulation, every patient basically has the right to get access to their medical records. So based on that, we partnered with major EHR providers. So in the US, luckily, if you partner with 7 EHR providers, you basically cover 80% of the market. So we partnered with them. We provided access to patients. We developed the MyMediport application, and then patients are basically able to integrate all their data together. So if you're visiting multiple healthcare providers, and your providers is listed onto our network, you can directly sync all your data into one place. And this isn't two data, so three different records that you're managing. We integrate all that data in one single view. But this is only solving the problem from the patient side. From the healthcare side, think of it from the perspective that if you're visiting a MyMediport enabled healthcare provider, all you need to provide is your basic demographic information and social security. the doctor would be able to search for that medical record through our platform, get it from multiple sources, integrate it together, and basically get an integrated view of the entire medical record. So what we're doing, we're saving time, we're saving lives, we're trying to avoid malpractice due to miscommunication. We're making sure that critical healthcare information is available to the healthcare provider. And of course, it also helps the insurance companies, when it comes to claims and so on and so forth. And the other side is basically the data and the artificial intelligence. So given the amount of data, what we can do is, we can run pretty interesting analytics on it. So, you can say that if, someone develops type 2 diabetes at 40 years of age, we can predict to a certain degree what the possibility of if this person would develop high blood sugar, high blood pressure around the age of 60, 65. So we can give you that percentage. Secondly, as far as COVID is concerned, drug development, vaccination, vaccine trials, study of adverse drug reaction, the time to market for a drug has significantly reduced. The reason being, the Spanish flu came out in 1918. In 1968, we had the Hong Kong virus, but from 2002 to 2022, we had H1N1, SARS, MERS, and COVID. So the time for every other next pandemic is shrinking down. We can't wait for the next 50 years, waiting for the next pandemic. We don't know what's going to happen in the next 5 years. So now coming into the Pakistani perspective, we look at healthcare, healthcare information and healthcare data. Now think of it as a use case. What we need, the need of the hour for the Pakistani market right now is a national electronic health record platform. And there are countries in the world who have developed brilliant national electronic health records. You have Australia, which has built My Health Records. You have
National
My Health Records, National Electronic Health Records.
Okay.
You have Turkey, which has implemented a brilliant national electronic health record platform. So what we are offering to developing countries is, is that we can develop a national electronic health record. What we mean to say with that is we can integrate data coming in from any number of hospitals together, bring it into our platform, and then integrate it together. So think of it this way: in Pakistan, where someone is incapacitated, somebody brings them to the ER, and they have absolutely, the doctor who has to provide them, the caregiver has absolutely no idea on the allergies, conditions, any procedures, medication statements of that particular person. We are proposing a platform where you only need to provide a computerized national ID card. The healthcare giver can scan it. Using our platform, we can fetch the entire clinical summary of that patient, and then the healthcare provider can take an informed decision and save lives. So when we started this in the US, today we were connected with 61,000, more than 61,000 healthcare touchpoints within the US alone. And what we're doing in Pakistan is, along with the Sehat card, which is a brilliant initiative for providing health insurance to the Pakistani people, we're also, offering this platform that, we can digitize all this data, bring it to one place, so that the value of the common man's life is higher than what it is today, basically. So we can give them that value. So that is basically our input from iPath and our My Mediport platform.
Thank you so much. Thank you so much. Just 2 questions. I have 2 minutes. Just 2 questions. Yeah, sure, please.
This is in interest of the patient and interest of the country, but not in the interest of the institutions. Right? They lose their targets, all diagnostics and all those kind of things. So how do you see overcoming this hurdle? If this happens, this will be a game changer.
I think, bureaucracy is a problem everywhere. So, it's not just a matter of the Pakistani bureaucracy, it's a matter of the North American bureaucracy as well. To get an insurance claim in the US is not easy for healthcare. You need 10, 15 days. You're spending around $200, $250 just to get your medical record out from the healthcare network, and then processing that file. Apparently, what happened in the US was the bureaucracy was broken by the government, so basic access to clinical summaries and patient discharge summaries were allowed to be given to the patients. I think on a policy level or on a regulatory level, if our government also allows basic access of this information, then third-party developers like us can actually tap into that information and make it available to healthcare networks. Everyone is selfish about their data. And there is a lot of regulations as well which is involved in it. So speaking about our experience, the first thing we had to go into was HIPAA compliance. Once HIPAA is an act. Once HIPAA compliance was met, we actually went into a high trust certification. Once high trust was done, we went into a SOC 2. And once SOC 2 was done, the AHR basically asked for a GDPR compliance. So for us, we basically came down meeting all these compliance requirements just to make sure that the bureaucracy is satisfied that we can get access to this information. And when we had access to this information and we started returning them value against it, that was basically where was the win-win for us.
Thank you. Last question.
So my question with Dr. Huma, how you see this twist if we compare public and private sector in education sector from the last 30 years? Might be at that time 20% was private sector and 30% was public sector. Right now the twist against totally. How you see, we are moving ahead, we are asking about budget, but the twist is of course very visible.
I'm a great believer of private sector coming into education, because what is wrong with the public sector? There is no accountability, there is no transparency, the bureaucracy is killing it. And they are not working for profits. Having a model which is not profitable in nature is not sustainable. So what I firmly believe in is a public-private partnership, where in a country like Pakistan we need to introduce a voucher system and a community involvement into the education of their children, which will allow parents to emerge as the monitors and the people who will hold the administration accountable. These suggestions have been on the table, but I think what lacks is a focus. We are still not focused towards improving education, and we don't see the missing link between the revival of economy and investing in education. How an economic turnaround in this country cannot happen, no matter whether you talk about export-led growth or whichever growth that you want to talk about, unless you impart skill and knowledge and tools of social upward mobility to the average person. And that is not happening. We perhaps need a multi-pronged strategy for that. So I'm not averse to privatization of education. I want a public-private system, but where there's corporate social responsibility, there's accountability, and we bring in more stakeholders into the situation. That's how I see it.
Thank you so much. Thank you so much. There are multiple takeaways from this discussion. I thank you, Dr. Marc Siegel. I thank you, Dr. Lida, Dr. Huma, and Alicia Shah. Thank you very much.